Hi, my name is Anna. I'm going to be a fourth semester Waubonsee nursing student, and today I've got a quick little video to tell you guys all about the program. This program gets you your ADN, which is your Associates in Nursing. It is 4 semesters or 2 years long, however you want to look at it. There are no summer courses. You do get a summer break. You only have classes in the fall semester and the spring semester. And another thing that I personally was worried about, so I'll get that out of the way for you guys, is can I work while I do this program? Yes, you can. Long story short, you need to commit about 3 days a week to being in class or at clinical. So you've got 4 other days to do with what you will. And you should also know, I'll dive into this a little bit later, but fourth semester does get a little bit heavier, but again, I'll talk about that later. Let's start with getting into the program. There are prereqs that you have to take, so make sure you guys are paying attention to what still needs to be taken, and you do need to do the TEAS test and get a certain score on it. You can take it more than once a year. That information is updated on Waubonsee's website, but I do recommend giving yourself enough time to retake it if you need to. So what I did personally for getting into the program was I came up with a plan. What are the rest of the prereqs I need to finish to get into the program? When do I need to take the TEAS date? And when do I need to apply to get into the desired start date? Which, by the way, you can start nursing program either in the spring, January, or you can start in the fall. So I would come up with a plan of what you want to do, run it by a guidance counselor just to make sure you're not missing anything to get you to start the program. Another important thing about the program is it does have a special admission process. So make sure that you guys are really paying attention to your deadlines because again, your admission date, cutoff date for spring semester is going to be different than the admission cutoff date for the fall semester. And same with the TEAS exams, so make sure you guys are paying attention to that. Once you're in the program and you've been accepted, you're gonna have to go to the doctor, have a physical done, have some labs drawn, make sure you're up to date on your immunizations. You're gonna have to do a background check, a fingerprint check, and a drug test. So there are a couple things you need to do, but it does go by pretty quick. And then when enrollment opens, make sure you sign up for classes. Some of the things you're going to need to make sure that you purchase for the nursing program are a stethoscope and a pen light and your Waubonsee Clinical Nursing Program, which is this gray scrub top that you can purchase in the bookstore. I believe you might also be able to purchase that online too if you don't have time to get to a bookstore. And then you will either need all black or all white shoes. Some of the things that might not be necessary but are going to be really, really helpful is purchasing your own pulse ox, which you can get on Amazon, as well as your own blood pressure cuff, which you can get on Amazon. I will say for my 105 clinical, I used my own personal blood pressure cuff every day that I went, so I do really recommend getting it. It's a good thing to have. And then one last thing that is going to be helpful for clinical is having a little clipboard that you can consolidate all of your papers into, because you don't want to lose those papers. When it comes down to how the semester is set up, each semester you will have 2 classes. So there's a total of 8 classes in the nursing program, but 2 classes per semester, and those classes are going to meet 1 day a week, and you can either choose morning or afternoon, whatever is easier for you to accommodate your schedule. So for example, I have 1 class on Tuesday morning and 1 class on Thursday morning. Each class also does have its own clinical. It's 1 clinical day a week, again, aside from 4th semester, which we'll get into later, but for the first 3 semesters, 2 classes, 1 time a week, and 1 clinical day a week. The way that clinicals have worked so far, my clinical, for example, is on a Wednesday. So I would go to 205's clinical week 1, 200's clinical week 2, 205's clinical week 3, 200 week 2, and alternate back and forth between clinical sites every other week. Or what happened for us in 120 and 150 was that we did all of 120's clinicals in the first half of the semester and all of 150's clinicals in the second half of the semester. So either way, you're going to get your clinicals done. The only thing that's different when it comes to like clinicals, you're not signing up for a clinical that comes with the enrollment of the class that you sign up for, and it does get assigned to you. I have seen some students maybe have difficulty with a certain day, so some students have been able to trade days. So if you find that a day doesn't work for you, don't freak out quite yet. Talk to your professor, see if there's anyone else in your cohort that can switch with you, because it usually ends up working itself out. Clinicals also do last longer than class time. So far, I think maybe in first semester, clinicals are a little bit shorter. Maybe for 105, I believe it was 6:30 to 4:30 p.m. And then for 110, that clinical was shorter yet, maybe 7:30 to 4:30. So about a 8 or 9 hour clinical for the first semester. But after that, clinicals are gonna be at least 10 to 12 hours long. So you should prepare yourself for a full day. So far, my clinicals have been at Aventera, which is a nursing home in Aurora. They've been at Elgin Mental Health Center, Mercy Hospital in Aurora, and at Thrive Rehab Center in Aurora. So all of them are pretty local. Like I mentioned, fourth semester does get just a little bit heavier. The first way it gets heavier is clinical time. So for one of the courses, you will have clinical twice a week instead of once a week. But that is only for 6 weeks. So again, you'll have clinical twice a week for 6 weeks for one of the courses. And that's gonna be either at the beginning or the end of the semester. For what's left, either before or after those 6 weeks, you'll be doing clinical for the other class. So, little extra clinical time, but it's only to prepare you for the role of a professional nurse. So just know that that's coming your way. The second way it gets a little bit heavier is doing more ATI work. ATI is where we're turning in our homework, clinical homework, we're doing practice exams, proctored exams. It's a good study tool. And it's going to help prepare us for the ATI, for the NCLEX in the long run. So we're doing more ATI work to prepare us for the NCLEX. So it does get a little bit heavier in that way as well. Something you do need to be aware of is the Waubonsee nursing passing grade. So we normally think of failing a class as getting anything less than a 60%, but for Waubonsee, failing a class at the nursing program, in the nursing program, means getting less than an 80%. So you need to have an 80% or higher to pass the class. Another thing that you need to pass the class is to have an 80% on more than half of your exams in that course to pass the class. So for example, a few of the courses will have 4 exams a semester. That means if you have to pass more than half of them, you need to pass 3 of them, which leaves only room to fail 1 exam. And remember, failing an exam means anything under an 80%. So yes, a 79% unfortunately does count as a fail, but they're holding you to that high standard to help prepare you again for the NCLEX and real world situations. One thing you should get really good at is math conversions. Each semester, you're gonna have a short, like 10 question math test that you have to get 100% on to move on with the course. Another thing Waubonsee does is have us return demonstrate skills in the lab. So they do have a sim lab, a clinical lab downstairs for you to practice those skills. And the skills involve giving PL medications, IM injections, catheters, sterile gloving, trach care, IVs, things like that, things that you're gonna need to know in order to be a nurse. One thing I forgot to mention about ATI is it is something you will have to purchase each semester because you will be using it each semester. I know I really talked a lot about it in regards to fourth semester, but you will be using it all 4 semesters. So it's an additional purchase, an additional fee to your tuition. You just go buy it at the bookstore. It's very similar to purchasing like an access code. ATI also gives you a bundle of books that a lot of the professors reference, which is really helpful. So you're gonna get all those books when you start the program, and you're gonna get your actual classroom textbooks at the beginning too when you start the program for the entire program, which is nice. The only thing that they don't give you in those bundle of books is stuff that professors recommend but aren't necessary to the course. So you get to decide if you wanna purchase those books as well. My biggest advice for the Waubonsee nursing student is, yes, school can be stressful, but do remember that it is temporary. There will probably be setbacks, but it's nothing that you can't overcome. You're smart, you got this. Try to learn anything and everything that you can at clinical, even if you think it's gross or I'm never gonna do this, just try to learn it just so you're able to say you did it. Study, hang out with the people around you, make friends with the people around you and people in your clinical groups, because they are going to know exactly what you're going through, and they're great resources, great people to bounce questions off of. They might be understanding something that you don't, and vice versa. And if you have a question in class, ask it, because if you're confused, the people around you are probably confused too. So yeah, make your friends, try your best, take it one day at a time, stay organized, and remember that you got this.